Hello everyone, this is Caroline Myers and welcome to my presentation on the disease process of asthma. The disease process of asthma is a very common chronic condition that causes bronchospasms and airway inflammation and is often categorized into two types, allergic and non-allergic. Allergic reactions can involve irritants such as pet dander, perfumes, infections, pollens, and molds. Non-allergic triggers can include anything from cold air, smoke, air pollutants, exercise, and even emotional stress. Asthma attacks can also be triggered by GERD, nocturnal asthma, which is changes in circadian rhythm and hormone levels. And in some rare occurrences, there's a clinical condition called the cyclooxygenase pathway of inflammation. And cyclooxygenase, or COX-1, is an enzyme that is found in blood vessels, found in smooth muscle cells, interstitial cells, found in platelets and mesothelial cells, and it plays a significant role in the inflammation process. There are two types of T lymphocytes that react and produce IgE and attract eosinophils, basophils, and mast cells. And when the IgE binds with the mast cells, it initiates a process called degranulation, and this releases leukotrienes and histamine. The system tends to hyperreact and it secretes copious amounts of mucus. It tends to thicken the bronchial airway and it increases bronchoconstriction and edema. An asthmatic reaction is a cascade of hyperactive events, like I had mentioned, and the severity of attack can depend on each person, depending on their control of the disease, the availability of medications for the person. It can fluctuate even over their lifetime, depending on their hormone levels and again, how well controlled the disease is. It also is dependent on the control of the disease and prevention of asthma attacks, as this is the key to reducing permanent lung damage over a person's lifetime. And here off to the right, you can see the difference of a normal airway versus an asthmatic airway. Asthma is very prevalent in our society. It is common across all ages, races, genders, and socioeconomic statuses. Approximately 25 million Americans have asthma, and that breaks down to about 1 in 13 people. Asthma is more common in adult females versus males, and it's actually the opposite for children, being more common in boys versus girls. And the reason why some women may be more apt to getting asthma as they grow older is they can develop adult onset asthma during or after menopause. And approximately 13 Americans die each day from asthma-related complications. Here are more specific statistics on the prevalence of asthma broken down by ethnic background as well as age. Asthma accounts for 9.8 million doctor's visits each year, is the third ranking cause of hospitalizations among children younger than 15, and African Americans are 3 times more likely to be hospitalized from asthma. Asthma signs and symptoms can vary depending on the person, but is characterized by wheezing, coughing, dyspnea, chest tightness, and high mucus production, as well as shortness of breath. The severity of these symptoms depend on the level of the actual hyperresponsiveness of the bronchioles and reversibility of the bronchial obstruction. Prolonged exhalations are commonly an early sign of airway obstruction. Severe attacks are accompanied by use of accessory muscles, distant breath sounds, and diaphoresis, and may only be able to speak one or two words before taking each breath. Rhonchi may be audible if the larger bronchial airways are involved. However, patients going into respiratory failure caused by marked airway constriction have inaudible breath sounds and a repetitive hacking cough. If the asthma is related to allergies, signs of chronic rhinitis may be present. This includes nasal edema, nasal polyps, rhinorrhea, and oropharyngeal erythema. Another sign can include eczema, and this indicates an allergy, of course, and may be present on the patient's skin, and particularly in the neck region and the patient's AC area and their popliteal spaces. Each person's prognosis can vary depending on several factors, such as well-controlled asthma and the prevention of asthma attacks. Children with mild asthma and relatively normal lung function may improve as they get older and not be severely affected in adulthood. However, children who have moderate to severe asthma early in life tend to have poorer outcomes in adulthood and more exacerbations. Approximately one-third of children have persistent asthma in adolescence, and about two-thirds can improve into their teens with well-controlled asthma. An average of 10 to 13 Americans die from complications related to asthma each day, and with that said, the overall doctor visits for asthma have declined steadily since 2010. And you can see the graph on the right-hand side from the year 2010 to 2016. There actually has been a decline in doctor office visits for children with the primary diagnosis of asthma. On the right-hand side here, you can see the short and long-term effects of asthma on each person. Complications in adults can be frequent sick days from work. They may have a higher risk for depression. For children, they may have growth delays and learning disabilities. And the commonality between the two is permanent narrowing of the bronchial tubes, side effects from medications, ER visits, greater risk of obesity, and lingering coughing spells. There's also a lasting financial effect. From 2008 to 2013, the annual economic cost of asthma was more than $81.9 billion. Broken down, that is approximately $3 billion in losses due to missed work and school days, $29 billion due to asthma-related mortalities, and $50.3 billion in medical costs. In 2015, the annual per person incremental medical cost of asthma was over $3,000. A few more risk factors that can affect a person's prognosis is family history and genetics. Children of mothers with asthma are 3 times more likely to suffer from asthma and 2.5 more times likely if the father has asthma. Premature birth can also have an effect. Children born before 37 weeks are also at an increased risk of developing asthma later in life. Babies or young children may be at risk of developing asthma later in life if they've had certain lung infections at an early age. Occupational exposures can increase your risk. This is called occupational asthma and is a common cause of adult onset asthma. As previously mentioned, hormones can play a part, especially for women during their onset or after menopause. And obesity can cause it. The extra weight around the chest may squeeze the lungs and make it more difficult to inhale. And also, fat tissue produces inflammatory substances, and that may influence the lungs and affect the asthma as well. Lung function tests measure your breathing to help your provider diagnose and monitor your asthma. These tests are often done before and after inhaling a bronchodilator. Spirometry is the recommended test to confirm asthma. During this test, a patient breathes into a mouthpiece that's connected to a device called the spirometer, or even a laptop or PC. It measures the amount of air a patient is able to breathe in and out and its rate of flow. Here they take a deep breath in and exhale forcefully. Here you can see a picture of a fancy spirometer right there. Next is the peak flow meter, typically a small handheld device that a patient will breathe into to measure the rate at which they can force air out of their lungs. This is not a diagnostic device necessarily, but often used to help keep track and monitor a patient's condition. This is a device that a patient can keep at home and use. A FeNO test is also called an exhaled nitric oxide test.